So hi everyone, invite you to join me as Master Teresa Qigong Master. So today we have Jonathan Fields, right? He's a traditional Chinese medical doctor. So he is also a practitioner and teacher of Qigong. So today we want to work very well with improving our well-being too. I use herbal medicine myself. Jonathan is a renowned acupuncturist, doctor of Oriental Medicine, a speaker and author. He spent a lifetime in martial arts with over 15 years of teaching experience, performing throughout US and China. So he has studied at the world-famous Shaolin Temple and the Beijing the Gulou Hospital. He currently owns and operates a successful integrative medicine clinic in South Florida, and he offers online consultations, herbs, and food therapy. You will really love Jonathan. Now, let's invite Jonathan into the room. Just wait for a moment. Hi, Jonathan. Please help us to know herbal medicine better.
Beautiful. Sifu, thank you so much for having me. It's an honor to be here and speak with a Qigong master like yourself. So we're going to try to condense 4,000 or 5,000 years of herbal therapy into a short session, but we'll give you guys some basics. One of the interesting things that you mentioned to me earlier was about how Qigong and the energy with Qigong, and one of the things I think goes together is it does go with the herbal medicine, and we had spoken about this in the past that Sheng, which is considered the father of the Chinese herbal medicine, about 3,000 or 4,000 years ago, when he was tasting the different herbs and coming up with the different herbs, they actually, in the TCM standpoint, we actually assign a taste, a flavor, and an energy to each herb, whether it's warm or hot or cold, and a channel, a meridian, different meridians that the herbs go to or enter or help with, just like we do with Qigong exercises. So there is some definite overlap. And I can tell you from my personal experience, herbal therapy is incredibly, incredibly powerful and very, very effective, sometimes even much more than medication. And for anybody who's skeptical about this kind of stuff, if you look at most of the pharmaceutical drugs on the market, the majority of them are based on an extract of an herb. So there is scientific basis for a lot of these herbs and for what they do. Aspirin, for instance, came from white willow, which is a traditional Chinese herb that's been used for a long time. Digioxin comes from foxglove root, which is a Shudi Wang, which is a yin and blood tonic, and so on and so on. So what I wanted to do today is speak about a couple things. One is some preventative stuff that we can use for what's going on now, and some things that you'll probably have common in your kitchen that you can use, so you don't have to go hunting in Chinatown. There's some things around the house that can be very powerful to use for daily use, like some of the things you're using probably for your teas as well. And one of the other questions you had asked me about is how to know if you're out of balance. So let's start with that. And the best answer for that, and before you get on any herbs that could consider to be very strong or could have any sort of toxic side effects, or before you start experimenting with formulas, I think it is always best to seek the advice of a professional herbalist or a doctor of Oriental medicine. How you could tell you're out of balance, if your energy is low, if you're having problems with digestion, whether it's bloating or gas or problems with your bowel movements, if you're having trouble sleeping, maybe staying asleep or maybe waking up in the middle of the night, many, many different reasons. I mean, herbology is basically our internal medicine. So there's thousands of herbs in the pharmacopoeia of the traditional Chinese medicine. In the United States and North America, there's probably about 200 or so common ones that we use, and probably about 200 different common formulas that we use. Then we mix and match them sometimes, and we can customize formulas specifically to the patient depending on their symptoms and on their constitution. So where this becomes important and why it's good to seek the knowledge of a professional is because I get a lot of questions from not only patients, but also from other doctors. They say, well, tell me what herb or what formula do I use for insomnia? Or what herb do I use for constipation? And while we have many, that's not typically how the Chinese medicine works. One of the most distinguishing factors of this medicine is that every person is an individual, and it's different based on the individual. Um, for instance, one person might have constipation because of yin deficiency, right? Maybe their body fluids are too dry. Somebody else might be constipated because of qi deficiency. Maybe they just don't have enough qi to, maybe they don't have enough spleen, stomach qi to actually push the stool through. So those people would be put on two very different formulas. And if you gave somebody the wrong formula at too high of a dose or for too long of a time, it could actually cause damage. So you still want to be careful. But we're going to go into basic stuff that you could use now around the kitchen, and we'll talk about some preventative stuff. So the first four herbs that I want to talk about that are very basic, we can all get them. They're lying around the house. If not, I recommend you should always, always, always stock these four things. One is mint leaves, right? So bohe, peppermint. You probably use it sometimes in your tea. And any mint, I prefer the fresh mint leaves. You can buy them dried as well. Some people like to use the essential oils. You can if it's food grade, but I always prefer to have the actual herb itself. There's nothing like the energy of a raw herb. That's the natural format. That's how it was used for thousands of years. That's how we should use it. So a lot of people drink mint tea. Mint has a few different properties. We use it for everything from venting rashes, measles to some extent, but basically for cooling you down for the most part, and also for qi stagnation. So if you have any liver qi stagnation, if you're hot-headed, angry, easily irritable, or have any sort of blockages, peppermint could be a great thing. So you can get peppermint leaves. More importantly now, we use it for external wind invasions. So within the TCM paradigm, basically, we consider any sort of infection, whether it's bacterial or virus, any sort of infection, we consider that basically an evil pathogen that got into the body, right? So if you're outside and the wind is blowing and it's cold outside and you got your shirt off and you're wet, you might catch a cold. So it's the same thing. The wind can carry in either cold or heat or dampness or dryness along with that wind. So peppermint is probably the first herb I recommend to keep around the house because you can use it whether it's wind heat or wind cold. You can use it for both. And because it is so pungent and aromatic, it's dispersing. So it helps it also helps with nasal congestion, runny nose, that kind of stuff. So a lot of sinuses are a big issue around here. So mint is one of those things that could help with sinuses. And once again, even with mint, it's mild, so it's safe for long-term use. It's safe for daily use. But if you are extremely deficient, it might not be the best thing for you to do too much of because it is so dispersing. It might disperse some of the qi. But if you know that you have a cold or a fever, first thing you should reach for is a few leaves of peppermint. You just boil some water, throw the leaves in a cup, pour some boiling water on it, let it steep 10, 15 minutes, and drink it. The next thing I want to get into, very, very important, and crucial herb that most of us around the house is cinnamon. So cinnamon, guija is the cinnamon twigs, and rogui is generally considered the bark of the cinnamon tree, which is considered hotter and more of a yang tonic than the guija, the twigs. Most of us have powdered cinnamon around the house. I would suggest getting the sticks if you can, because if you're drinking tea and there's a bunch of powder in it, sometimes it gets all over your lips. Some people don't like that. It's easier. You throw in a little peppermint, you throw in a cinnamon stick. Now what do we have? We have hot and cold. So now your formula is balanced, right? Yin and yang, because the cinnamon is considered warming, it's hot, and the mint is cold. So that way you're not going any too far in one direction. Now, if you have a high fever, you'd probably want to skip the cinnamon and do more mint. But a lot of times, when you're sick, let's say we were basically what we call a wind cold invasion, which would typically be more chills than fever. So if you're having a lot of chills, you can still have fever, but if you have more chills, typically you'd have headaches, neck and back pains, sore, achy muscles. In those cases, you definitely want the mint and the cinnamon, and you'd probably use more cinnamon than the mint. The other beautiful thing with the cinnamon, we actually use it to relieve pain also. So we use it for gynecological issues, for injuries, everything from tendonitis to carpal tunnel. Cinnamon is pharmacologically known to be a vasodilator, meaning it actually opens the blood flow. It encourages blood flow. So it helps when you have those muscle aches and pains, arthritis, any of that stuff. Cinnamon can help. The only time, again, like I said, cinnamon would be contraindicated in large amounts if you have a very high fever or if you have pain and a lot of heat in the body. So let's say if you have rheumatoid arthritis and your joints are always hot and swollen and physically hot, cinnamon you'd probably want to skip. We have herbs that move blood and clear heat would be better for that. But if you have the chills, or if you have typical pain, or you have like the arthritis type of pain that's worse with cold weather and dampness and rainy weather, absolutely cinnamon is a great thing for that to use. And same thing, you could actually just pour some boiling water in there. There's other ways to cook herbs. This is just the simplest for us to do to keep around the house. So keep some cinnamon sticks around the house and keep mint leaves around the house. The two more very common herbs I wanted to talk about, one is ginger. We're all very familiar with ginger, right? Ginger activates the spleen. It's good for the spleen and the lung and a couple other channels. It's incredible for digestion. If you have any sort of nausea, most of like the Dramamine and those motion sickness pills, the main ingredient is ginger. So you don't need to go run to the store and buy some chemical crap with who knows what kind of synthetics and fillers and other junk they're putting in there. Get yourself fresh ginger root. And if you want, you can freeze it. So you can freeze ginger root. It stays in the freezer. It'll be fine. In the fridge, it'll last a few weeks, no problem. So if you're making some tea, once again, ginger is considered warm, slightly hot. There's different types of ginger. If you use the powdered ginger, Jiang, would be considered very hot. It's hotter since it's processed. If you pan fry ginger, it's panjiang. It's just even hotter than that. But the fresh root is basically warm, so it's safer for use. Sheng is fresh ginger. It's phenomenal for digestion. It also helps remove toxins from the body. One of the reasons they give you ginger when you eat sushi, one, sushi is considered cold and damp, and two, the ginger is considered warm, and it helps remove some of those seafood toxins. So ginger can also help induce sweating, which will get rid of chills. So once again, if we have fever, you wouldn't want to use too much cinnamon or too much ginger, maybe a tiny bit. But if you have chills, you want to have some of the mint in there, and you want to go heavy on the cinnamon, heavy on the ginger. Normally, I probably use maybe a 1/4 inch to 1/2 inch of ginger root. I slice it 2-3 times, throw it in a cup, put the boiling water on there, and use it for that. Did you have a question, Sifu, or a comment?
Yeah, so you're reading my mind. I was just thinking about, wow, that's very good information you have. So we have 3 things. We have the mint leaf, it's great. And then we have the cinnamon. The cinnamon is also good for the balancing blood sugar, right?
Yes,
so that's
absolutely.
why you say open
Right.
blood flow. So, and then the ginger, yeah. So is it okay to take the ginger? I mean, even in the summer, doesn't matter.
So it is and it isn't. So once again, it depends on the person's constitution. The fresh ginger root is pretty safe, the Shengjiang. Now, once again, you got to keep in mind your body constitution. We in the TCM we break things down and we categorize people by your body constitution. So some people are very hot, some people are very cold, some people have excess, yang. Some people have deficient yin. So it kind of depends on the body type. So if you're the type of person who always feels hot, you probably don't want to do too much ginger. If you're now many of us, and actually I find personally with my patients, are the majority of the people I see are more on the Qi deficient side and more on the Yang deficient side. The majority of them, not all of them. So those type of people, absolutely, ginger would be good for you all year round. And in the summertime, from a TCM perspective, we do want to sweat more than the wintertime. In the wintertime, we want to preserve our sweat. We want to preserve our yin. In the summertime, you're going to accumulate extra dampness. So that extra heat will help you. And the ginger actually also, that's the other two things I didn't mention about the ginger. It dries up dampness, and it also helps resolve phlegm and mucus. So if you're having, once again, a cold and you're having a runny nose, or if you have rhinitis, sinuses, if you're coughing up phlegm and mucus, the ginger is great for that. Now, keep in mind, if your mucus is yellow and green, which from Western side, we consider that to be more bacterial infection, but from a TCM side, we would consider that to be hot phlegm. You don't want too much ginger. You can have some, but you don't want too much because that's considered to be.
So then what would you do instead of ginger? Then what would you use then?
We'll get right to that next. There are a couple herbs. The thing I wanted to mention last about the ginger is typically what it is indicated for is if you're having a lot of white phlegm or clear phlegm or very thin, runny, watery phlegm and mucus coming out. Lots of ginger. And like I said, if you're the cold type, lots of ginger. The next herb that I wanted to talk about, which actually works for hot phlegm, it's still not the main herb that you'd use for hot phlegm. For hot phlegm, typically we'd use things like bamboo shavings and things like that. But these are not your typical herbs that you're going to find laying around. So if you do have the hot phlegm, definitely the peppermint still. You can use the peppermint. You can use a tiny little bit of ginger, not too much. If you have hot, if you run on the hot side, actually one of the herbs you could use is chamomile, right? So typically from a TCM standpoint, we use more chrysanthemum, juwa, the yellow tea, right? But it's, most people have chamomile tea at home. So chamomile is cooling. So if you have a high fever, you can take the mint leaves and you could take a bag of chamomile tea, throw some mint leaves in there, or throw a bag of mint and chamomile tea together, and that'll help relieve some of the heat. The other herb that we use specifically for phlegm and also for qi stagnation and also for rectifying the middle or for moving, we use it for constipation to some extent. It can be drying in long term, but it's safe overall. Tangerine peels or any citrus peels. The citrus peels are one of the main herbs that we use that are mild but are effective for phlegm and mucus within the TCM pharmacopoeia. So tangerine peel, Chen pea is probably the most common one that we use, and the way they process it is they age it for 3 years. You don't have to worry about that. You can also use any citrus, right? So if you got grapefruit, maybe Juhong, lemons, limes, right? Whatever you got laying around, you use the fruit and you just save the peel. You save the peel, you let it dry out. So if I was having the cold and chills and a lot of runny nose or phlegm and mucus, I would do the mint, I would do the cinnamon, I would do the ginger, and then I would throw in some citrus peels. Any citrus peels. Everything from the pomelo, the tangerines or the mandarin oranges are the most common ones. Bitter oranges, the green little oranges before they become immature oranges, is jike, which we use a lot for qi stagnation as well. Liver qi stagnation. So it's one of the excellent things. They're bitter and acrid. They're drying, but they're not considered as hot or as warm as the ginger. So if you have more of the hot phlegm, like I said, I would probably do the mint, maybe chamomile, and maybe some citrus peels. That would be an excellent thing. And like I said, if you wanted to speak to an herbalist, it'd be better to get a formula from an herbalist because some of the phlegm herbs that we use can be toxic in large doses, like banxia. Banxia is a pinelia. It's a very hard little thing. And in very large dosages over long periods of time, it can be toxic. So it's best to have a professional like myself or a local herbalist to prescribe that. But everything that we're talking about today is very, very safe.
Well, in Chinese medicine, we talk about combining things so that they help the whole formula become balanced. So that's why we like someone to put a formula together, right? So I've been using herbs for 10 years before I do Qigong, and I find the Qigong works so good together with the herbs, and then that's when I feel my health really change. Because the herbs help me, but it doesn't raise my energy up. And then when I start doing the Qigong, then they work very well. So I do use herbs as my maintenance. So I'd like to ask you, Jonathan, is what would you think? Because we know when we are not well, we go to see the CCM doctor, they measure the pulse, they look at your tongue and and I ask questions. So with what's going on in the society, and then also the people may not be in Florida, right? So they may not be able to see you. So is it possible they can get help from you, even like this?
Yeah, absolutely. And thank you for asking, Sifu. I do phone and Skype consultations for functional medicine and herbal medicine. So people can send me their lab work from all over the country or all over the world. They could send me their blood test results. And then what I would do is I'd get on the phone with them or get on the Skype call. We go through all your symptoms. We go through your diagnosis. We go through your lab work. I'll take a look at your tongue, front and back. And then I have a lot of questions that I generally ask them. I'll probably spend 30 to 45 minutes just asking different questions, everything from how you sleep to your urination, your bowels, your menstruation, and so on and so on and so on. And that is how we get to the root of what your constitution is. And then we make sure we treat not only the symptoms, which is the Western allopathic model, and which is why it never works and why you see people that are going to the doctor never really get better, because they're only covering up your symptoms with a Band-Aid. We are going to address your symptoms, but we're going to look for the root cause of the problem so we can address that. That way you can get better and stay better. And everything we use, of course, is all natural, very little to no side effects, especially if you're working with somebody who knows what they're doing and can prescribe it and keep in touch with you and make sure you're going along the right path. Because it's very important. If somebody is Yang deficient, you're not going to give them the same herbs as somebody who has liver fire. It would be a disaster. It would make the person worse. Just as if you were to give somebody the wrong medication in the hospital. So that is one way. Anybody, if you want to look me up, you could find me. Integrative Medicine US is the website, or integrativemedicine.us. So instead of .com, it's integrativemedicine.us. Or if you want to look up my Instagram or Facebook, it's at iMedicineUS, and that's I like the letter I. And then the other question you asked me, some preventative stuff for what's going on right now. There's another formula that is pretty safe for most people to use. We use it basically for what we consider to be a Wei Qi deficiency, which is basically lung and spleen Qi deficiency for the most part. But people that have Wei Qi deficiency usually have two things, common things that we see. Normally, they get sick very often. They get a lot of upper respiratory infections. These are the type of people that they have a cold every other week or every other month. They get the flu, and the next week it's a bronchitis, and so on and so on. And sometimes there's a lot of spontaneous sweating because their Wei Qi is not controlling the pores how they should be. So they're losing body fluids. It's a very simple formula. It's 3 herbs. And it is safe for most people, even if you don't have the Wei Qi deficiency. For almost everybody, this would be safe to take in a very small dosage right now. And the 3 herbs that it consists, the name of the formula is actually Ping Feng. And there's 3 different herbs, and we'll put the spelling up later.
You can send it to me, and then we can post it up for them or something. Yeah.
Fantastic. But the 3 herbs on there, they're very simple. I'm not going to give you the whole background on them. The first herb in there is Wang Qi. Wang Qi is a tonic. Yeah. It's a Qi tonic. and it's Astragalus. So very common herb. You find it in pretty much every G&C shop or anywhere.
I have one too.
Exactly. So personally, I prefer the raw herbs to make a tea with them. But you could get this formula in powder, which is the second best way. You can get it in capsules, or you could get it in the little black tea pills, which is probably the least effective way to take it.
Exactly.
But anything is better than none. Wang Qi is actually shown to increase your white blood cell count. So it raises your immune system, but it's an immune modulator. It's not gonna, so if you do have some kind of autoimmune condition, Wang Qi is not gonna like throw that off. It's also used in kidney disease. They use it to treat cancer. They use it a lot of times for chemotherapy, for the side effects from recovering from chemotherapy and radiation or post-surgery. It's excellent for building qi in blood. It's a fantastic herb. They make injections out of it, all sorts of stuff. But that's the main ingredient of the Ping Feng song. The second one is Bai Zhu, which is white atralicodes. I don't even know how to pronounce it, the Latin name of it.
Yeah, we'll just type that up so they can
perfect.
They can check it out, or they can write you for information. You know, it's just
Absolutely. So Baiju is also a spleen tonic, and the reason a lot of this is focused on the lung and spleen, because the lung is actually the first place we catch an infection normally, right? We breathe it in through the nose or the mouth, like what's going on now, or it comes in through the skin. And from a TCM standpoint, the lung actually opens up to the skin. It controls the skin to some extent, and that's why we talked about the sweating.
Exactly.
And the spleen actually also stores and filters platelets and makes white blood cells and filters red blood cells. It has a lot to do with your immune system. Western medicine considers the spleen is not necessary, but if they remove your spleen, they actually put you on antibiotics for the rest of your life, an oral antibiotic, because you're more susceptible to infections. So it has to do with digestion, transporting body fluids around, and so forth. So that second herb being Baiju. Baiju is its main thing is it dries up dampness. So it activates the spleen as well, and it gets rid of extra dampness. Is kind of like humidity. And just like people with arthritis, oh, it hurts more when it's raining outside. It's a real thing. We are affected by the weather. We are affected by the climate. We are affected by the foods that we eat. Just as if you're eating too much, just like how some people just retain more water, right? And it's not always a heart issue or a kidney issue. Sometimes it's a spleen issue.
Yeah,
right?
I think it's very interesting to just recap, right? So at the beginning, Jonathan was saying that a lot of Western drug actually is based with herbal medicine.
Almost all of them. Almost all of them.
So just to recap a few, just to help people to understand, is like aspirin has, what's aspirin has?
White willow.
White willow.
Yeah.
You know, just these little things help us to understand. So there are things we can think about more, right? Exactly. So what is something else you like to remind people? Like,
absolutely. The last thing I would like to tell people, like I said, I cannot stress it enough, that in TCM, it's not, I have insomnia, so I take this formula. That will not work, and you're likely to do more harm than good. So you always want to see a professional about it. And most importantly, more than herbs, more than anything, do your Qigong. You cannot, our body is not meant to sit at a desk all day. It's not meant to sit in the car, to sit at the computer. The Qigong does more for you, I think, than anything else. And the more Qigong you do, like you said, in your case, you will actually be more sensitive and more perceptive to what the herbs are doing, to what channels are entering.
Because I am actually very low in my qi when I started before, is I was sick every month, right? Very low. That's why the herbs does not help me very much, because I was so low. So if I didn't actually do qigong, I cannot even raise myself up. But after I raise myself up, then I change the kind of herbs I take. Then it starts to make sense then. So they really walk hand in hand very well. So
that is an
I wish
excellent
nobody
point.
get too sick like me before they get started. Do it
That is an
sooner.
excellent point. I am really, really glad you brought that up.
Yeah.
Because you're correct. If you are very, very Qi deficient, and if your middle jiao is obviously Qi deficient, if your spleen, stomach Qi deficient, it's going to be very hard for you to process the herbs. So even if you're taking the herbs, even if you're taking medication, one, you're not going to absorb it properly. And specifically, if you're not doing any exercise, if you don't have good circulation, if you don't have good blood flow, those herbs are not getting to every cell in your body. They're going to come in and go right out. You might not even digest them at all. So you might just be throwing away your money. And that's part of the problem with our society. Everybody wants a pill. Everybody wants a magic herb. You have to do your Qigong.
Yeah,
And
if everything worked together like a team would be nice. That's what we want, because they all useful. Is how to put everyone on the spot to work together, and that would be great. Yeah.
And the last thing I want to stress specifically about the Qigong, because I have a lot of people think, oh, I do exercise, I don't need Qigong. And I say, no, it's completely incorrect way of thinking. Because you can over-exercise, and you can actually cause damage. You can create yin deficiency. You can create injuries. You can create things like that. You will never get injured doing Qigong, not if you're doing it right. Two, the problem is with the exercising is you're missing the spiritual and the mind-body connection component.
It's really calming the mind, so that you have to feel all your stress is gone. So you have nothing to really need to think about it anymore. And then when you do physical, once you finish, you still think. But when you go to do the Qi nicely, you really empty your thoughts out and then go to we'll say elevated vibration. And then at that moment, you just feel no worries. You feel you can.
100%. And yes, right. You're talking about Wu Wei, Wu Shin, right? And you don't get that with exercise. Because if you talk to people, if they're out jogging or they're at the gym on the treadmill or riding a bike, or you're still thinking, even when you're lifting weights, you're thinking about the office, you're thinking about your kids, you're thinking about making money, you're thinking about returning phone calls, or I got to do the laundry, which is the opposite of what we want in Qigong or in Tai Chi. We want that wushin. We want to empty the mind. We want to dissolve all that stress out. And most people are like, oh, well, I can't meditate. But that's not how we teach them. We teach them first. We teach them the breathing exercises. Then we teach them the posture, right? Right. So when you're thinking,
that's right.
Yes, no, continue.
Well, I was just saying that Jonathan is such a treasure in Florida to actually teach Qigong and know herbal medicine and acupuncture, all these beautiful knowledge coming together. And then I have to say, just encourage people in Florida to take advantage of someone like this. And then you are in South Florida, right?
Yeah, absolutely. I'm near the Fort Lauderdale area, Coral Springs, Florida. It's about 15, 20 minutes west, northwest of Fort Lauderdale. About 20 minutes from Boca Raton, maybe 45 minutes from Miami. I have people that come see me from South Miami, from the west coast of Florida. When you're good at what you do, word gets around, as you know, and people will drive.
So they are very good. We'll say they're always very good doctors of TCM around. But then maybe not everyone actually understand how to practice Qigong. So it's not everyone really understand how it works, right? So Jonathan, he has really enjoyed the practice himself. So he really understands how they work together. So for people actually very lovely people, love energy work, sometimes you just worry about the person give you herb, don't know what it means to do energy work, right? So he actually understands. So he understands what it means, so it has some benefit for you.
I'm very glad you brought that up, and actually it does make a huge difference in the herbology, and as far as very much so in the acupuncture treatments as well. Unfortunately, in this country and probably in the Western world, probably 98% or more of people who practice acupuncture don't practice Qigong, which doesn't make, they say, oh, well, I do yoga, oh, I go to the gym. It doesn't make sense. That's not
the same.
Part of this medicine, the root of this medicine, and Qigong is actually what drew me to Chinese medicine because Qigong was, just like you said, for you, it helped you from being sick. Qigong was so effective, and I guess it made such a difference in my life from practicing that it made me believe in this medicine and made me want to learn more about TCM and Chinese medicine, because I mean, it totally changed my life around. And as you know, you're a witness of that as well.
Yeah. So because when I was taking herbal medicine, I was taking 10 years already because I was so weak really, but it helped me, but it did not actually really raise me up. So I just think that if the beautiful, powerful things can come together like a team, right? So become a team, then you get two tigers, you know, the beautiful herbal medicine and then the Qi. And then you can even have the beautiful Western doctors all work together, the emergency, the all important work together like a team. And then it will be so amazing for the society, and look forward for that day.
Yeah,
Okay.
and it's, like you said, it's much more effective.
Exactly.
I mean, I've had patients, just like you said with the herbs, I've had patients that come in and they've been on Nexium or you know, some kind of acid reflux medication for 10 years or some other medication for 10 years, and it just doesn't work. Or maybe it works a little bit, but they don't get any better. And that's why I call the practice integrative medicine, because we try to integrate the Western medicine with the herbal medicine. We also do functional medicine with the supplements and vitamins. And then we teach them Qigong exercises so they can do their own medicine in their own practice at home.
That's right.
The more you put into it, the more you get out.
Perfect. So thank you, Jonathan. So I think we have provided good information for the audience. It will help them understand how to enjoy the best of the West, the East, and your knowledge in Florida will be an asset for that. So, okay. So thank you very much. And I'll see you again.
It was an honor and a pleasure, and I really appreciate everything that you're doing, and keep spreading the good word. And thank you so much for helping all the people that you do help, spreading the knowledge of Qigong.
Thank you, everyone, and then let's enjoy traditional Chinese medicine with Qigong. Okay, bye.
Blessings. Bye, Sifu.
Thank you.